Now, the month of October is a month used to observe, celebrate, pay attention to many things. We are looking at mental health awareness now with Dr. Katija Khan, who is a clinical psychologist and neuropsychologist. She's a lecturer at the Faculty of Medical Sciences, UWI, and a member of the UWI COVID-19 Task Force. There are many more things to her name, but we want to get right into the conversation and say thank you for joining us. Doc, how are you?
Thank you for having me, DK. I'm doing well, thanks.
No. As an immediate past president of TTAP, the Trinidad and Tobago Association of Psychologists, what are some of the activities that TTAP would have been doing during the month of October to highlight mental health awareness?
So I'm actually a past president, so my term ended a couple of years ago, but I am a member of the association, and there have been a number of activities that the association has engaged in. So early on in the pandemic, a hotline was created to offer some counseling to persons who were in need, and that hotline has been ongoing throughout. It's been offered both in English and in Spanish for persons who are in need and can be accessed by anyone. And it has been accessed by a wide range of persons, members of the public, healthcare workers, etc. Behind the scenes, TTAP has also been working in other ways, not directly related to the pandemic and mental health, but in ways that we hope to improve the profession and delivery of psychology. So, for example, we're currently working on establishing licensure for psychologists. So that's something everybody can look out for in the coming months and year.
And I want to go even further back to brass tacks. If I had to ask you to define mental health and its importance, where do you take me on that ride?
Oh, well, let's take that ride together. So what is mental health? So you should think of mental health as a state of your psychological well-being. How will you know that you're having good mental health? So are you able to fulfill all the roles in your life? So personally, socially, professionally, are you leading a productive life? Are you able to do the things that you want to do? So persons hopefully are striving towards that optimal functioning. But I want us to think of mental health on a continuum. So on one end of the continuum, you have good mental health, optimal mental health. But on the other end, you have poor mental health. And this is where you're struggling. You're struggling to cope with your everyday activities. You don't feel well, so maybe your mood has been down. And sometimes on the extreme, some people may need professional help, or they may need to be hospitalized. And here's the thing, at any point in time, we're somewhere along that continuum. And if you are facing a stressor, if you have been facing some difficult circumstances, that can take a toll on your mental health. So you may slide down the continuum. But if you have some positive things going on, you've had a success or some opportunities, if you have good coping mechanisms, then you may be higher up on the continuum. So it's not a black or white picture. We can range anywhere along that continuum. And our goal is for persons to have as much optimal well-being as they can.
So one of the things you spoke about, stressors. COVID-19 is a stressor if it is nothing else. And what kind of reports have you been getting, or what kind of conversations have you been having? What kind of things have you been seeing on the ground, seeing that you've been a member of the UWI COVID-19 Task Force, just being the role that you are in general? What can you tell me about people along that continuum at this point in time?
So you're quite right. I think unanimously we can agree that the COVID-19 pandemic is a huge stressor, and it has led to unprecedented, heightened levels of stress among everybody. So whether you are elderly, whether you're an adult or a child, everybody is facing these heightened levels of stress. And early on, it was predicted that we would see an upsurge in mental health problems. We're also seeing an upsurge in things like domestic violence and things like child abuse of all kinds, substance use disorders, and mental health illness in general. So we are aware that one of the fallouts of this pandemic has also been, it's taken a great and significant toll on people's mental health and their general functioning as well. So through the UWI COVID-19 Task Force, and through other research efforts, we have been looking at the impact of the pandemic on people. So for example, in students, we have seen high levels of anxiety. So they're very concerned with the impact that the pandemic is having on their current schooling, but also their future career opportunities. Amongst the general public as well, we have been investigating people's levels of depression and anxiety. And I can share with you some of the results of a recent study we did where we were looking at people's levels of agreement with some of the COVID-19 restrictions. And we found generally high levels of agreement with the measures. So people do agree, about 90% of people roughly agree with some of the measures, like the frequent hand washing, the closure of the borders, the closure of schools. But we saw lower agreement for some other measures. So for example, only around 80% of people agreed with not with restricting your visits to friends and families or only taking essential trips. Now, what are the implications for that? If we have 20% of people who don't agree, that might affect their compliance. So they might be more likely to take risks and not observe these measures. We also found lower levels of agreement with these measures amongst the men. And so this is not something peculiar to Trinidad and Tobago. In general, men tend to engage in more risky behaviors and they're not as compliant with some health behaviors. So I think that's also pointing to a need to have some messaging that's probably targeting specifically men, encouraging them to comply with the measures. So that is some of the research that we've been doing, and we hope to be sharing in the coming months a lot more about that research as we look at the impact of the pandemic on healthcare workers, on police officers, defense force workers, etc. So that's going to be forthcoming.
Right, now we have about 2 more minutes on this side, but your answer raises a lot of points, and I want to find out about the applications of psychology and professionals using or in this arm. And I say that because you say you have the results that will be coming out in a while. I want to know how are those things taken from research and acted upon so that knowledge is used with regard to how policy is informed. You also spoke about men and mental health. You spoke about protective services. We'll get into those in just a bit. But the applications of psychology at this point in time, what are they? Where do they stretch? How vast are they?
DK, I don't think there's a field where psychology is not relevant. And I think more so now where we realize that so many people are being affected by mental health. And not just at the level where they may be diagnosed with a disorder. I think just in general, people need more support as it pertains to their functioning. Many of us are high functioning. We're able to wake up every day and go out and do our jobs, but we're still feeling this additional sense of stress. Many people are experiencing what they're calling now COVID fatigue. We're so tired. We're so frustrated with the restrictions, with the change of our lives. We're all grieving the loss of a life we once had pre-pandemic. And so people need more support in dealing with that. So one of the things we've found is that throughout this pandemic, there has been a demand of psychologists and their services. So whether it's in the public health sector, helping patients or persons who are in quarantine or helping the healthcare workers, whether it has been in the education sector, so help for teachers who are managing the transition to online learning, or children who are managing that transition, whether it is companies and workplaces who have been dealing with layoffs and being made redundant. So all of the changes that are happening in the workplace, whether it is just people wanting to figure out, how do I continue to cope? How do I continue to show good coping skills? How do I prevent myself from that COVID-19 fatigue? Even some of the other areas. So for example, all of this online remote work. So whether you're dealing with eye strain, so for example, the field of neuropsychology and medicine, we overlap. So we tell people, you know what, take a break. So every 20 minutes, you're supposed to look away from that screen for 20 seconds and focus on something else to help prevent the eye strain. Also be wary of how you manage your online time and make sure you're getting some of that social connectedness as well. So there are many, many areas. I could go on about the many different areas psychology is relevant and psychology can be utilized during the pandemic. In all the different sectors, whether it's the health sector, the organizational sector, and just in terms of people's general functioning in their homes and in social spaces.
And speaking of that general functioning, when we come back from the break, I want us to speak specifically to stigma and support. But we do that when we return. Stay with us. Welcome back. We are speaking about mental health awareness with past TTAP President and clinical psychologist, Dr. Katija Khan. Now, Dr. Khan, I want you to start, we start back. I want you to speak about stigma and mental health, please. What is your experience like with stigma and mental health in Trinidad and Tobago?
So stigma has been one of the biggest barriers as it pertains to mental health. So both stigma and discrimination. So stigma relates to the kinds of thoughts and ideas we have about mental illness, and it's usually negative. So for example, if we think that somebody who has a mental health illness, that something is wrong with them, something that they are damaged, or that they may be violent, or that they're not capable of making decisions, that they're not capable of holding down a job or to function in the workplace at home. So it's a huge barrier for us in the country because the impact of it is that people are less likely to want to seek help for fear of being judged. I mentioned earlier that men are sometimes less likely to seek help. And we see that with mental health as well. Because when we consider the impact of some of our socialization on gender, so we think that men should not express certain emotions. Men should just be able to tough it out and chin up and continue along. But what that is having a tremendous impact. So as you're showing in that graphic, we know that the suicide rate for men is higher than that for women. And part of the reason is that men choose more fatal means when they're trying to harm themselves, and therefore they're more successful in those attempts. And so we have to intervene way before that. We have to normalize people talking about mental health. So just as you would say, if you had a headache or if you broke your foot, you would not feel any shame to tell somebody, oh, I broke my foot and I have to wear a cast, or I twisted my ankle. And so I have to rest it for a few days. We need to normalize people talking about, I'm finding it difficult to cope. I haven't been feeling myself. I'm feeling really sad and down these days. And we have to be willing to listen without judgment, without trying to blame, without rushing in to find a solution. Sometimes we just need to listen to people. So I think we have to think about it on two levels. Just let us talk more about our emotions, how we are feeling. We have to understand that that's okay for both men and women. We have to understand it affects young children as well. So children can be affected by mental health problems. And then on the other side of the continuum, we have to recognize when somebody needs professional help, when sometimes they've tried to do what they could. So they've tried to do their own coping, their own relaxation. They've spoken to others, they've spoken to friends and family, but you realize it's just not improving. We need to normalize seeking help, that you go and you talk to a doctor, you talk to a psychologist, you go to the wellness centers. If there's not a wellness center in your area, you go to your nearest health center and you ask for help. But DK, the other side of that is that we need to ensure then that we have sufficient services. So when people come to the clinic and we realize they do need help, that we have enough psychologists and psychiatrists and other mental health professionals who can assist them, that they don't have to wait 6 months or 2 months before they can get an appointment. So we have to make sure that if we do tell people, go and seek help, we have to make sure we also have the resources available for them when they do seek that help. Else, sometimes they're going to get turned away from the system. So we have to make sure that we're encouraging both things and filling both sets of needs.
Well, I see one of the things is that Dr. Othello and the health minister they've been speaking about decentralizing the mental health care system as it obtains in Trinidad and Tobago. I see positive, I see negative with that. Negative in the sense that some people may not want to go right where everyone knows them. because of that same stigma and discrimination. But do you think the pandemic has helped to reduce stigma a little bit? And I say that because people have been speaking about possible stressors, the fact that you need to guard your mental health, you need to seek help, you need to try to cope. These are some of the tips to cope. Do you think the pandemic has helped in that way, the disruption of the pandemic, and kind of helped to normalize seeking mental health a little bit?
Yes, I think you do have a valid point there. And before I continue on that, I just wanted to say one thing about decentralization. And I think that is, it's been an initiative that's been in place for years. And I think it is a fabulous initiative. It is certainly best practice in terms of where delivery of mental health services should be. We need to get away from the idea of this psychiatric hospital that has a lot of stigma associated with it. And we need to normalize people being able to access services within their own community. So as I said, let's put it on par with physical health. If you broke your leg, you don't want to have to travel miles away from your home to go to one place to get help. You should be able to get help right where you are. And other people should be okay with that as well. So as we start to combat the stigma and discrimination, we're going to find that that augurs well for decentralizing as in turn. So back to your question about the pandemic being the great equalizer. Yes, because we are seeing now that everybody's been affected. So no matter who you are, your station in life, what you do, your background, that everybody is experiencing the stress, they're experiencing the anxiety, the concern, the fear. And so we realize that navigating your mental health is a very normal thing. So just as how with your physical health at different points in your life, you may have better physical health, you may have poorer physical health, and you would do things to help improve that. It's the same thing with mental health. So right now it's at the fore, it's on everybody's radar, and hopefully that continues to be something that lasts in terms of we recognize that mental health is important, that it affects your physical health as well. So mental health and physical health are inextricably linked. People who have better mental health have better physical health outcomes. And the converse relationship is true as well, that if you have poor mental health, it can also lead to poorer physical outcomes. So we are seeing the importance, and hopefully that continues, that in years to come, when we can look back on 2020 and talk about the days of COVID-19, that we are still able to hold on to the importance of good coping skills, managing our stress well, recognizing that self-care is not a luxury, but self-care is critical for our healthy functioning, and also realizing that while this health pandemic is unprecedented, it may not be the only thing that we ever face, and that it may change life as we know it. So there may be things that we have to get accustomed to that may not go back to pre-pandemic life. So in adjusting to that change as well, it's going to require some of those psychological coping skills. And so I like that we're continuing to talk about it, that we continue to emphasize it, that we recognize that people are struggling with mental health, and therefore we need to figure out on a whole, how can we help people deal with the stress in their households, navigate conflict in the workplace, adjust to changes they might be experiencing. So whether it's online schooling, remote work, cut back in your work hours, etc. There's been a lot of change. And so we have to learn how to adjust to this change, and knowing that this change may be with us for years to come.
And this conversation will be one that we have again and again and again. We want to thank you for this installment, Dr. Khan, on doing the work that you do. And on behalf of the entire news team, I'm DK Roster. Thank you for joining us. Have a good night.